Hello, we're live here at the OSU College of Pharmacy. Do you think prescription drug abuse is a significant problem in the U.S.?
I do. I think people are using medicines at unprecedented rates. I think a lot of times it's in elderly populations and it can be unsafe. I think a lot of times people don't realize that just because the medicine has a prescription that it means it's safe. That's not necessarily true. I think all medicines can be dangerous, especially if they're not used correctly. So I think it's definitely a problem, and it's definitely something we need to pay attention to.
I haven't really heard that much about it, so I'm not sure if it is a significant issue in the U.S. or not, but I could see how it could be.
Absolutely, and I think it's actually increasing substantially. I've seen in my clinic persons come to us that want help to get off of these different medications, but we're limited in our ability to help them. I think it's absolutely an issue.
In my experience, I haven't really seen, I haven't had any personal knowledge of prescription drug abuse. So personally, I don't feel there's a problem.
Yes, I do. You're reading in the paper all the time about felony charges and people that are stealing prescription pads and writing their own prescriptions, and you have the rehab facilities that are overcrowded. Patients are on waiting lists trying to get in to get rehabilitation, and I definitely think it's a problem.
Oh yeah, I believe medication abuse is a big problem in the U.S. I volunteered last summer in a pharmacy at my hometown, and it was assisted pay pharmacy, so I don't want to be stereotypical, but a lot of people there, you could see people that actually were grateful for medications and others that you could tell maybe were faking, maybe perhaps faking a pain. Some pains get like Vicodin or hydrocodone and stuff like that. So yeah, I definitely think there's medical abuse in the United States. That's a big problem.
I do. I think it's a problem. Working on a college campus, I would assume that this is really one of the primary ways students who abuse drugs are able to do so. It's probably easier and it feels safer to go out and get drugs like this from a medicine cabinet than it would from somebody who deals illicit drugs.
Do you think it's okay to use someone else's medication if they give it to you?
No, I don't. Because if it's not prescribed specifically for you, you don't really know how it's going to react with your own body chemistry, plus any other things that you might be taking, whether it's actual medication or some sort of vitamins, things like that. There are too many dangers involved with taking something that is not specifically prescribed for you.
No, because the medication prescribed to someone else might not be the best one for another individual. There's a lot of things that factor into the decision for a medication.
No, I don't.
Why?
Because a doctor has to prescribe it, and they have the medical knowledge to know the different symptoms and what the reactions that they can have.
It is definitely not okay for people to take prescriptions that aren't prescribed to them. Prescriptions are prescribed for a particular disease or condition and are prescribed to the individual for that use. And to use it outside of that purpose is not only not beneficial, but also is illegal.
Okay, so there's the whole healthcare.
No, I don't think it's safe. I don't think it's right because we are different. You might have a problem that I don't have. I might have a problem you don't have. So.
It depends on what it's for and how strong it is. I'd say only in extreme situations.
No, you should not take somebody else's medication because you don't know if there's other drug interactions depending on the meds that you're on, your condition and whatnot. So I would definitely not take a medication that was not prescribed to me.
Why do you think we use so many medications here in the U.S.?
I think it's because patients are going into their doctor expecting a prescription, and if they don't get one, they're unhappy when they leave. So I think doctors feel pressured to write prescriptions, even if one's not really needed.
Well, I think the American culture is that if you're ill and you go to the physician, you expect to get a pill or a tablet that'll make you feel better. I think until our culture and lifestyle change, it's still going to be a constant issue in the U.S. that we overprescribe. We are always looking for a quick fix, and many things require lifestyle changes, and nutrition changes, and exercise.
Well, I guess, well, also the medication, I don't know, I'm mechanical engineering, so I really don't have any expertise.
Just an opinion, yeah.
But, I think the medicines here are a lot weaker compared to the rest of the world. Also, there's a stigma in the USA that something that's not allowed is more desirable, or desired. So, around the world, I can go to the pharmacy in Egypt, get OxyContin. Normally, it's not as abused as it is here. The medication in Egypt's a lot stronger, so I get off of flu in a day or two. Fluorest? Have you ever tried Fluorest compared to Tylenol here? It's awful. I don't know, I have a feeling that more things are banned here, so it's a lot more desired. As if over there, stuff is stronger, and it's culturally tabooed, and it's available, so nobody cares.
People in the U.S. use so many medications. I think a lot of people here kind of just are looking for an easy answer, so instead of kind of doing things on their own, taking care of themselves, they just resort to meds.
Is prescription medication abuse safer than illicit street drugs?
It depends on the illicit street drug. I mean, if you're smoking weed or doing shrooms or something like that, it's definitely a lot better for you than abusing a prescription drug.
Oh, I don't know. That's a good question. I think it probably depends on the drug and the situation. So yeah.
Prescription drugs are just as dangerous as street drugs when it comes to illegal use. Some of the prescription drugs are as addictive or more addictive than street drugs. And I think it's a common misconception that because they're a prescription, they're safe. Prescription drugs have side effects, in particular when not used properly, can be quite dangerous.